Hello, everyone, and welcome back to Winnipeg to this year's CR Arthritis event. I'm Kelly Lendvoy, VP of Communications and Public Affairs, and I'm really happy to be joined today by Amorell Saunders N'Daw, is a trained journalist and a partner with Knightsbridge Robertson Surrett in its National Academic Executive Search practice and the firm's Equity, Diversity, and Inclusion Lead. And Dr. Alan Zhou is a Rheumatology Resident at the University of Toronto. He works in the Division of Adult Rheumatology at University Health Network's Toronto Western Hospital. Welcome to you both.
Thank you so much, Kelly. A pleasure to be here.
Thank you for having us, Kelly. Nice to meet you.
Now, you two leaders in your field are presenting, I think, a very exciting topic, not just for myself, but for our entire audience, because it's in a subject area where ACE is spending a lot of its time and in terms of focusing on public policy priorities around health inequities. And the workshop that both of you are leading in Winnipeg at the annual meeting is titled Cross-Cultural Communication, Embracing the Diversity of Your Rheumatology Patients. Maybe just to start us off, what, in general terms, what are your objectives for the workshop?
So I would say that cross-cultural communication is a topic that's very important in day-to-day clinical care. And our main objectives for our workshop are to talk about what cross-cultural communication is, and what implications it has both for patients and for providers in day-to-day clinical practice. Really to talk about the challenges that clinicians and patients face on a day-to-day basis, and really to introduce concepts and ideas for how to mitigate some of these challenges.
Alan and I will be joined in Winnipeg by Dr. Nicole Johnson and Dr. Susan Humphrey Murto. So the four of us are going to be spending an hour of time talking about the importance of cross-cultural communications with patients and what it means. And so some of the key objectives, as Alan just mentioned, is just to recognize that there are challenges to cross-cultural communications, particularly in the clinical setting, and to talk about some of the impacts that language and cultural barriers can have on patient care. And we want to be able to talk about some of those important components that lead to effective cross-cultural communication, like understanding language. And I know that Alan will be spending a bit of time in our workshop speaking about that. And we'll hopefully leave the participants in the workshop with some approaches that they can take with them back to the practice setting to help enhance cross-cultural communication.
Fantastic. Our audience has been following ACE as we've been looking at this issue, particularly during and now after the pandemic. We all know that during the pandemic, a lot of fault lines were exposed in terms of the healthcare delivery to people, but particularly to Black, Indigenous, and people of color, who we call BIPOC patients, were seeming to receive less equitable care and having more difficulties accessing care. We've looked at that with national surveys, and what we found is that BIPOC respondents do indeed face significantly greater barriers when accessing arthritis care, and when they do, benefiting less from their interactions with their healthcare professionals. I'm wondering if you can talk to our audience a little bit about this in terms of how we as a healthcare system and how we as professionals in the arthritis community can try to ensure that the cultural background and beliefs of patients are respected and integrated into that clinical environment and into their arthritis treatment plans.
That's such an important issue that you raised, Kelly, and I can speak from the patient lens, and having had to be a caregiver and support to elderly parents whose mother tongue was not English, it was French, and it was a challenge. And so we know that clinicians are busy but want to deliver the best care. And so sometimes time may not be on their side because of the stresses and strains in the system, a lot of patients to see. And I think one way that can really help enhance cross-cultural communication is the amount of time that is spent with the patient, getting to understand them, getting to be more aware of cultural norms and beliefs and maybe approaches to care and having a conversation around that. So I would say a focus on relationship building as opposed to the transaction of, asking questions about how they're feeling and writing a prescription, and spending a little bit more time, which we're challenged by, I think would go a really long way to improving cross-cultural communication between the patient and their healthcare provider.
Yeah, I would add and echo Amorell's thoughts there by saying that, when I think about a patient and physician relationship, I view it more as a partnership in care. The physician is there, to provide advice, to provide knowledge. But at the end of the day, the patient is the one who's living with the disease, and they're the ones who are going to have to make decisions about how to treat their condition. Oftentimes in rheumatology, there's no one right answer. So what might work for one patient might not work for someone else. And I think that's where the importance of really getting to know your patient and what they value, really comes to the forefront. So just being able to take the time to engage in shared decision making, I think is really important, in our day-to-day practice as physicians and healthcare providers.
That's interesting. One of the things that we know and what our audience lives with on a daily basis is that their disease, if it's inflammatory arthritis, is often a complicated and complex one. And the healthcare team is not just them and their rheumatologist, but them and quite a few other people that, we like to think of the patient as sort of the quarterback of the team. If they have all of the information, if they're comfortable interacting, and we know that could obviously be a challenge for some of the patient populations that we're talking about today. But in terms of that shared care, in terms of interdisciplinary care, does that also present extra challenges and issues in terms of the topic that your workshop is looking at?
I think that cross-cultural communication, when we just look at it in terms of a encounter with a physician and patient, that itself can pose a lot of challenges. And when we think about the complexities of arthritis care, as you mentioned, Kelly, when we think about all the other players involved, our allied health members, our government, our pharmaceutical companies, I think that just adds multiple extra layers of complexities to this care. Right. So, we talk a lot about in our presentation, techniques for physicians and for healthcare providers, frontline providers to use when they communicate with patients from diverse backgrounds. But I would say that you bring up a very important point, and we have to consider other members of the healthcare team as well.
And I would also add that there are a lot of barriers. So oftentimes, depending on the cultural background that you come from, the sort of power dynamics of speaking to a doctor, that could create a barrier where you may not want to question what the kind of information the doctor is sharing with you. So I think it's important to create a culture of sensitivity and understanding, spending the time to ask really, supportive and compassionate questions would go a long way to ensuring that the patient feels valued and is part of that shared decision making.
One of the findings in our national survey on health literacy was the whole concept around not just finding information, but being able to use information. I think that's also something that is implicit in the topic that you're looking at. And I'm wondering specifically as it relates to today's world of healthcare, and that is patients going and using the internet to find information, and then sometimes being in a position where they're trying to communicate with their healthcare provider through digital means. So in terms of this modern paradigm that we're working under now and with digital health and the access to information online, sometimes reliable, sometimes not reliable, what does this dimension add to the topic as you guys are looking at it in the workshop?
I think that's a very interesting concept that you bring up, Kelly. I think when I think about modern care as it relates to using the internet and using digital means to communicate, I think certainly it's brought about a lot of benefits to care. It's helped improve access to care to different communities. And it's provided patients with a lot of power and a lot of autonomy in terms of patients wanting to learn about their disease and wanting to have educated discussions with their providers. I think as it relates to cross-cultural communication, I think the other point I would bring up is that when we talk about arthritis care, a lot of it is, painted in one color on the internet. And we just have to realize as providers that our patients are reading things online, they're educating themselves, which is so important, but that, we have to kind of consider where they're coming from as well.
I would say that there's an assumption that in today's day and age, with the strong focus on technology and digital communication, that everyone has access to digital communication. I would argue that that may not always be the case when we think of the social determinants of health, including socioeconomic issues. Not everyone might have access even to the internet. And language again is a barrier, and so there could be a reliance on family members to help interpret and translate information when they're in the clinical setting. So while it's prevalent, it's not always accessible, particularly from folks who come from traditionally marginalized communities, including folks who may live in northern or remote locations where they may not have strong internet connections. So we need to consider that as well.
I think that's an excellent point, and it actually was a question I had that I think you've sort of answered, and that is, it's one thing for us to be talking about this issue living along the border in the southern urban regions of Canada, and it's quite another to be looking at it or examining it from the perspective of northern rural remote communities. And it's something that we hope your profession is going to be looking at carefully. It's certainly it's another public policy focus for us, is that when we're talking to government now, in whatever province and certainly in the territories, there are serious gaps in models of care for people living in northern Canada. And again, I think that was exposed over the last few years, and we're hoping, and we're starting to see some of that addressed now. Maybe as a final focus for us, and to give, I love the title about embracing this topic amongst professionals. I guess what would be encouraging for our audience to learn would be, what are we doing? What is being done to address this? So in terms of leveling up people's cultural sensitivity in terms of how they deliver care, what sort of training is there currently, or in theory, what are we talking about in terms of what we're hoping to see in place?
I would add that I'm glad that issues around equity, diversity, inclusion, indigenization, social justice are being addressed at every level of organizations. And I know that the Canadian Rheumatology Association, it's a key priority. And so it's a pleasure for me to be advising them in that regard. And they are providing resources, including webinars to members. And it's on their the agenda for their annual scientific meeting. So we certainly hope and encourage as many participants as possible to attend the workshop. And there's a lot of information about how to enhance and improve cross-cultural communication that's available, like we said, online. And I would think that from a curriculum perspective, that these types of topics are being added to curriculum in academic institutions as well.
Just to speak to that, I think from a medical training perspective, over the last several years, I've certainly seen a shift in a focus on these types of topics. I mean, I started my training just under 10 years ago now, and I think even just in the span of this last decade, I've seen, curriculum change before my eyes. Before, when we didn't really talk a lot about these topics, to now we're having more and more conversations, more and more discussions at the medical school level, at the residency level, at the academic level. And I think that just speaks to a shift in culture. And I'm hoping that this shift in culture will continue to happen, that, we'll continue to learn to pursue, equitable care at all levels of healthcare, both from, training all the way till, practice.
That is very encouraging for our audience. So I think what I'm hearing, a key takeaway for our viewers, is that words are being put into action. And I think the face of arthritis, not from a patient perspective, but the face of arthritis from a clinical and a healthcare professional perspective, has sort of mirrored what you've described, Alan, in terms of that transformation over the last 10 years. And the people providing the care look different now. And I think that's also very encouraging too. I entered the community 10 years ago, and it was a bunch of older white guys like me who I was seeing, and it wasn't reflective at all of what the patients and society looked like. So I think there's a lot of reasons to be encouraged, and the work that both of you are doing and presenting is very, very important. And I would really look forward to being able to follow up with you on this topic. As you said, it's evolving quickly, and would love to be getting updates from you as you continue to do the work that you're doing. So thank you so much for joining us today. Both of you have a great conference in Winnipeg.
Thanks so much, Kelly. It was a pleasure to be here.
Thank you for having us.
And thanks to our viewers for joining us on our CR Arthritis. And we look forward to seeing you again